Endometriosis. What is endometriosis? Simply, endometriosis means that the lining of the uterus, what we call the endometrium, where the baby sits, the cells of those lining can go elsewhere where they are not supposed to be. They can go to the muscles of the uterus, they can go to the ovaries, they can go to the bowel, they can go to the ligaments holding the uterus, they can go to the urinary bladder, and they can also go into the tubes. Did you know that endometriosis is one of the major causes of infertility? What are the signs of endometriosis, and who are the people that are most likely to do an endometriosis scan? Females in childbearing age with painful periods. Too much pain during periods is not normal and should not be normalized. Painful intercourse is also a sign of endometriosis. When you go into periods and your flow is too heavy, that is also a sign. Infertility can also be a sign of endometriosis. Irregular periods or even missing them for a long period can also be a sign of endometriosis. So during this scan, we look at the different sites where these cells can go. And if they go there, they cause problems. If they go to the eggs, they can cause what we call cysts, endometriomas, which can be painful if they are too big and can also cause infertility. Within the muscles of the uterus, what we call adenomyosis. When those cells go to the muscles of the uterus enlarges because it is fighting, it is seeing these cells as intruders. So it fights against them. And time of inflammation and fighting inflammation, these muscles enlarge and the uterus becomes bulky. And actually, this can also cause infertility because anytime you cannot get a baby and anytime you get miscarriages. So that is also a site of endometriosis. The ligaments that hold the uterus. The ligaments that hold the uterus is also a site of these cells, and they can be painful. Look at the bowel. The bowel is also a site. When these cells go to the bowel, they can cause the wall of the bowel to thicken and narrow the lumen where the fecal matter passes. So most cases you find such women complaining of constipation. Why? Because the lumen where fecal matter passes is thickened by that nodule of endometriosis. So anytime the fecal matter remains in the bowel without passing out, the body absorbs water from it and then it hardens. So you find somebody saying, I have constipation. Go to the urinary bladder or the tubes that bring urine from the kidneys to the bladder. That is also a probable site for these cells. When they go there, they cause the bladder wall to thicken. And also, it can block the tubes that bring urine from the kidneys to the bladder. Why is that serious? Because if the tubes that bring urine to the bladder are blocked, so the urine is going to collect in the kidneys, what we call hydronephrosis. And in the long run, if this is not detected earlier, the kidneys are going to start failing. It is very important for somebody to screen endometriosis early. If you have those small signs that I talked about, painful period, heavy periods, painful intercourse, please, you have to get screened for the endometriosis. We screen you and we stage the disease and we help the gynecologist plan the management that you need so that you'll be well.